struggle, and through my sickest years I had very little supports or services, and I vowed as soon as I was well enough to do everything I could as an advocate to make those supports and services out there for everyone else with hepatitis C.
Tomorrow's a brand new day. Listen what the children say. You can wish your fears away. Tomorrow's a brand new day.
I think anybody that's been on treatment can relate to those lyrics really, really well. I know treatment for me was a real struggle, and I became suicidal. And thank you to really great doctors, I got through all that.
My practice began over 20 years ago when I felt there was a need for education for people with hepatitis C. Am I number 12? And what does that mean? That means that 1 in 12 worldwide have hepatitis B or C. The Canadian Liver Foundation offers support and education programs for patients, for families, as well as healthcare professionals. The World Hepatitis Canadian Steering Committee has been brought together with many individuals, medical professionals and other stakeholder groups. And these are the individuals that participated in creating the 6S nationally in Canada.
Lots of people that I talk to every day online, people like me, middle class, people, working class people who don't want to admit they have hepatitis C. But it starts from this one event and all of us coming together for we can all come out and talk about hepatitis C and then make a difference. Get people in treatment, get people supportive care.
For those who don't know, I'm a liver specialist and that's all I do. I'm trained in gastroenterology, but I'm trained in liver transplantation. I see about 6 or 7 Hep B's a day and about 8 or 9 Hep C's a day. The problem actually appears to be getting worse. 60,000 people, we believe, in British Columbia with Hep B, 60,000 with hepatitis C. That's 120,000. In comparison, there are only 12,000 patients with HIV.
There are about 600,000 people in Canada infected with this blood-borne disease. My experience began in 1970. I was given 3 units of blood while I was being operated on for tubal pregnancy. And during the next 2 decades afterwards, I suffered from what I thought was Montezuma's revenge. I was down in Mexico, and so I never dreamt that anything else was wrong.
We need to be treating more. We've said that treatments are getting better, and we should not be looking at a screening test, which the ALT is, to make determination as to whether a person is eligible for treatment or not. This is absolutely wrong, and we should correct it. We have to deal with prevention. We have to deal with harm reduction methods, which is a basic human right.
So important that people understand how difficult treatment is for some people. Every week that Kelly was on treatment was like a milestone. She was in and out of hospital. It wasn't just weekly visits, it was phone calls continually when her phone was not disconnected because she was so isolated. I think that anybody can go through treatment who is medically indicated with the right supports in place.
In January of 2000, I went to Vancouver to be evaluated for liver transplant. That's the time when I met Dr. Herb, and I really liked his bedside manner. Bernadette said that she was going to give me her liver. She said this was a gift, and she wanted me to see my daughter get married and see me and meet my grandchildren.
There are lots of new drugs for both viruses, actually, and this is also what is encouraging for us and very, very exciting. I've been doing this for 15 years. When I would see a hepatitis C patient and we would look at what their treatment options were, it was interferon, intron A, and the cure rate, and we weren't even using the C word back then. We were using, well, you might respond, and your chance of responding is about 6%. Presently today, we're saying, well, it can be anywhere from 50 to 80% depending on your genotype, depending being in the stage of the liver disease.
We have to look at prevention in its true sense, and we've got to get out to where the action is. In the influenza outbreaks and the influenza programs, we go to the malls. Let us don't expect the people to come to us.
We do about 3 dozen transplants a year, so right now, the average waiting time for a cadaveric transplant is about 8 months. Although the incidence of hepatitis C, hopefully, is decreasing, but the apparent prevalence is clearly increasing, and the burden on society is increasing.
We need lots more to be done so that people mainstream, like Kelly has agreed to come out and admit that there's hepatitis C without fear of losing a job or fear of being stigmatized.
I find that every day in dealing with people who have hepatitis, who have professional jobs, they whisper to me, I have hepatitis too. It's like, you know, it's not something we need to be ashamed of, and it's something we need to support them through.
Well, I used to be Hep C positive about 2 years ago when I was 18. And I was the lucky one because I was able to clear it on my own without any treatment. I've just been helping bring awareness towards other youth who live on the street, who may be young, who may not really want to go to support groups. They come to me. I'll take chances and I'll jump into a situation where I may not know what my outcome's going to be, and I work my way out.
Without tackling stigma, it's not, it's difficult to prevent. There are people that came up and talked about their support groups that they make in their communities, that people can't feel they can even come to them if they want to because they're afraid. They're afraid of how people might see them, might view them. The community needs support. It needs support from government, from governmental organizations, from physicians, from nurses, from general volunteers all over. And one of the great things about World Hepatitis Day, the very basics goes a long way to starting to address stigma. This is not a disease that's transmitted by casual contact.
We keep saying we don't have enough hepatologists, yet we know that the condition can be adequately dealt with by nurses under appropriate supervision. There are no mechanisms in place right now to fund nurses, nurse practitioners in settings other than in a hospital, other than in a Ministry of Health setting.
We are in effect, as nurses, walking through with patients and seeing how their lives are changing. The lives being changed with being diagnosed with hepatitis B or hepatitis C. Going through the assessment and finding out exactly how that disease or virus has affected their livers, their lives, and coming up with a game plan together to evoke some change.
It took me 5 years to find a Hep C support group, and it was the group that eventually turned into Hep C BC. As a result of meeting other members, I found out more about treatment and what it was like to go through treatment. A lot of people are being cured, we hope, and but unfortunately there are a lot of us out there that it hasn't worked for, so we still need research. We hope that you'll support Hep C BC or your own local group so that we can together